Hello everyone, welcome back to Nursing with Bonomi, where we put the page into practice. I'm Nurse Nay, and the man behind the cam is Ben the RN. Today we're going to be talking about tips for taking care of dementia patients. Tip number 1. For any patient with dementia, it's really a good idea to approach slowly and from the front if possible. If you approach too quickly, it can startle them and make them feel uncomfortable. If you approach them from the back as well, it can startle them and make them feel scared, and they may get agitated. So that is my first tip, and it's pretty much the easiest one to do. Second, I would recommend if the patient has become a little bit agitated, you don't want to have like a lot of people coming in trying to help. The more people you have coming in trying to help, it just creates fuel because everybody's talking, everybody's trying to touch the patient to help them, and it's just overwhelming. So I would say 2 people at the most is what you should probably have when dealing with an agitated patient with dementia. Now stay around to my last tip because it is the best tip that I have for you when you have dementia patients that you're caring for. Okay, let's go ahead and talk about what to do when your dementia patient is getting a little bit agitated. This usually is called sundowners, and it happens around like 3 to 4 p.m. So some good interventions that might help is giving them a snack that they like or a drink that they like, giving them like some ice cream, or giving them some like nice smelling lotion. Little hand massage is really nice. And one that everybody likes is a back scratch. You just give a little back scratch and everybody says, oh. So that's a really good tip. You can't go wrong with a little back scratch. So what happens when your patient is just so agitated that they become combative? It's unsafe for you to be near them because they start hitting you or spitting or trying to claw you, which unfortunately does happen. The best thing to do in that situation is to make sure they're in a safe spot and leave the room. Just let them be, because the more you try to touch them and you're thinking you're trying to help them, it's just going to make it worse. So make sure they're in a safe place, that the bed is in a low position, and just leave them be, and then check on them on a little bit. You can always peek in the door and look at them. So those are some of my tips. Now my last tip, which is something I think is very important, you always want to make sure that your patients with dementia are medicated for pain. So pain for a dementia patient, they're not able to communicate that necessarily. They don't have the faculties to come up to the nurse and say, hey, my back hurts, I need a Tylenol. They just don't have the ability to do that, but that doesn't mean that they don't have back pain. So a good idea is to go through their diagnoses. If they don't have a routine Tylenol, they probably have arthritis. If they're 85 years old, it probably hurts whenever they wake up. I'm only in my 30s and I hurt when I wake up. So make sure to try and medicate for pain however often you can. If they have a PRN Tylenol order, just give it in the morning, give it in the evening, because you know that they have pain. They just can't express it. And pain is a very common cause of agitation and aggression in dementia patients. So if you have a patient without an order for routine Tylenol, I would highly suggest that you talk to the doctor and just say, hey, my patient has dementia. She has this or that diagnosis, or just say she's like 85 years old. I think they would benefit from routine Tylenol. it's usually no problem. They say go ahead. So if you guys have tips for taking care of dementia patients, please leave them in the comments below, because everyone has their little tips and tricks. And I hope this was super helpful. This was a video that was requested by one of our subscribers, Out of the Dark Ministry. So thank you so much for requesting this video. If you guys have any video requests, please make sure to leave them in the comments below. We'll give you a little shout out when we record the video. Make sure to subscribe and hit the little bell so you get notifications, and come back for the next video where we keep putting the page into practice.